Lane?
Yes.
Sir, my name is Nicole Reichert. I'm one of the physician assistants working at CHMB. Pleasure to meet you. I'll be conducting your neuro exam today. To look at the first part of our neuro exam, please see the first video, which goes over the general appearance and status, repeating abnormal or not taken vital signs, going over the head exam, and going into the cranial nerves. So please see that to go over the cranial nerve flow and function. Today we're going to be doing the motor, sensory, cerebellar exam, and including the deep tendon reflexes. So we're going to be touching and kind of moving your arms around and following some basic instructions. And if you have any questions, please let me know. So I'm going to be, actually for draping purposes, because I want to be able to see the tops of your thighs and your legs, we're not going to be using a drape if that's okay. So at first, we're going to be looking at the uppers and lowers in general for any kind of atrophy, any kind of involuntary movement. So make sure you're bringing it up above the shoulder to look at the main muscle structures. Would you mind if I lift your gown up? Just look at the front of your thighs. And we're looking all the way down to the back of the legs. Again, looking for symmetry, any involuntary movements, tremors, or atrophy. And I'm going to be palpating all of the 7 muscle groups of the upper extremities and lowers for symmetry and bulk. I'm going to test them at the same time, and then I'm going to do some passive range of motion looking for rigidity and tone. So I want to be touching, kind of giving a gentle squeeze to your arms and your legs. So testing again, symmetry and tone, symmetry and making sure we're going all the way down. And I'm going to be touching your upper thighs, perfect, and back of the calves. I want to touch underneath your leg a little bit too, just testing the hamstring. And this is just a gentle palpation and relax. So to test for rigidity and tone, which can happen with a lot of upper motor neuron issues, I'm going to have you relax your arm. I'm going to kind of hold it, like we're giving a little handshake, but I'm going to be moving it around. So I want you to think of your favorite place in the whole world, be Hawaii, on the beach, drinking a mimosa, okay? And we're just going to give it a gentle range of motion. So it should have a little bit of rigidity. And through experience, you get kind of used to what a normal tone is. Now, if someone had really an issue in their upper motor neuron, it can become very spastic, and this can be really difficult to gently move around in the range of motion. And make sure we're bending and extending and doing the wrist as well. I'm going to do the same for your lower extremities when we move on to your legs, okay? So again, I do the arms first. So we're going to be doing the strength of your upper arms. So what I'm going to have you do is hold your arms out like a pizza. Just like that. I want you to close your eyes, keep it nice and strong. I'm going to push down. So we're feeling for symmetry and contraction. And if our hands are up like this, we're going to monitor our patient without touching them. This is called looking for pronator drift. So this is a normal response after about 10 seconds. If the arm, I'm going to move your arm a little bit, was pronating, so when it kind of twists and starts moving down, that's a positive finding. So that's what we're looking for. But this is normal. You can open your eyes and relax your arms. Excellent. Okay. So the deltoid, we were checking for C5, our cervical root, spinal root innervation of 5. Now we're going to move on to C5, C6 with flexion of the elbows, and C6, 7, 8 with extension of the elbows. So I'm going to have you put your dukes up, just like this. Now, we're not going to punch anybody, okay? But you're going to keep it nice and strong, okay? My humor is good with my patients sometimes. So keep it nice and strong. I'm going to try to pull it. You're going to resist me, both sides. Excellent. And the same thing, I'm going to push back towards you, so you can try to extend your arm or straighten it out. Excellent. Okay, relax down. I'm going to be holding your wrist here. We're going to try to extend our wrist, meaning we're going to try to push our hand to the ceiling, okay? So push it up, hold it up, and I'm going to try to push it down. Excellent. This one too. I'm going to try to push it down. Perfect. Next, we're going to test for grip strength. So to protect ourselves, I cross my fingers like this, so when they squeeze, it doesn't hurt me. So I'm going to put my crossed fingers in here. I want you to squeeze hard both sides. Perfect. And I want you to spread your fingers. This is for finger abduction. I'm going to try to bring the pinky in with the thumb. Perfect. And we're testing for strength and symmetry. So when we were extending at the wrist, we're looking at C6, 7, and 8 For grip strength was 7, 8, and T1, or the median nerve. Finger abduction was C8 and T1. Thumb opposition, which is when you're trying to push that thumb in. Now we kind of do it finger abduction that first time, but to really isolate it, I want you to try to bring your thumb to your pinky, and I'm gonna try to push back on that thumb. You can also ask them to make an OK sign, and you can make an OK sign, keep it nice and strong. I'm gonna try to open it up. And if that stays nice and strong, it's the same thing. This side as well. Make that OK sign. And I'm gonna try to make that thumb go back. So that also tests for thumb opposition. Keep it nice and strong. And that's looking at the C8, T1. Next, since we're starting in the uppers, we're gonna test for sensation bilaterally as well. So I'm gonna roll this up. Thank you, on this side. And for the sensation, I want to test at least 2 dermatomes in both the uppers and the lowers. So we're going to do light touch first, and then we're going to do sharp versus dull. We do not sweep, meaning we don't do this. We touch, light touch. See how this is different than sweeping? Because I don't want to cross multiple dermatomes. I want to be very isolated with my light touch. Okay? I'm comparing bilaterally, and I'm going to ask my patient, say now whenever you feel something. Okay? So if you close your eyes for me and tell me when you feel me touching your arms.
No. 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 No.
So I checked at least 3 dermatomes at that. Just make sure you're assessing at least 2. And now you can open your eyes for me. I'm going to grab a Q-tip just to show you what it is. This side is going to feel dull, and to give a little bit more action, this is going to feel sharp. Let me know when you feel sharp or dull in either of your arms.
Okay.
Okay, please close your eyes. Sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Perfect. Excellent. So we're assessing for sharp or dull, and we're gonna do the same thing at the lower extremities. For position sense, since we're doing the uppers right now, what we could do, I usually like to do that in the lower extremities first. If that's abnormal, then we can move up to position sense of the thumbs. But if it's good for the big toe, that's when I kind of go up to the upper arms. Okay? For vibratory sense, I'm going to need my my tuning fork for 128 hertz, which I will show you separately in the next video. So because we're doing the uppers, I'm also going to check reflexes. This is not a tomahawk. This is a reflex hammer. It is a gentle, you're going to let the hammer work for you. I'm only using my thumb and my index finger to let the hammer fall. If you try to karate chop, you will not get a good reaction. So I'm going to testing the biceps reflex, the brachioradialis reflex, okay? And the triceps reflex. So how I do the biceps, once you relax your arm, I'm holding his elbow and supporting it. And again, like we take blood pressure, his arm is kind of tucked underneath. And I'm going to put my finger right on the biceps tendon. If you can see, my thumb is pressing on the tendon gently. This is my IP joint, so I'm going to actually gently tap my finger. Or you can tap directly on your nail. Now you do not have to see movement. You're feeling the contraction underneath your thumb. The same thing for the triceps, relax your arm. This is probably the hardest one to really get them to relax. And you're going right on the triceps tendon. And again, gently swing. There we go. So you're looking for a little bit of contraction and a little bit of swaying. Sometimes it's not very obvious, but when you see somebody that has hyper-reflexive reflexes, this really does move. And the last one is the brachioradialis. So the arm is slightly pronated, resting on the patient's lap. And I use the flat side, because your brachioradialis comes down just like this, and we're going to use the flat side. Sometimes just turning it a little bit can help. There you go. So you're seeing a little bit of flexion down into the hand, and you're seeing a little bit of that movement there. And you want to check on both sides. You can test the biceps reflex, them also just resting on their lap. So you feel that biceps tendon, you put a little bit of pressure. Want to make sure you have enough wiggle room. I'm hitting you, not myself, there we go. So I'm feeling that contraction of the biceps muscle. And now we're bringing it out. Again, try to relax as best you can. Good. And then resting it back in your lap. Again, slightly pronated, using the flat side of the hammer. And we're going to do a gentle. If you can actually really see the contraction right here, if you want to come look, right? So if you look right up here, you can see that contraction. Perfect. Okay, so we've done the upper extremities, both motor and sensory. And we can also add a little bit of cerebellar coordination because we do finger to nose, just a test for coordination. So if you don't mind, are you right-handed or left-handed?
Right-handed.
Would you use your right index finger to touch your nose? Then I want you to touch my finger. Then I want you to touch your nose again, and my finger's gonna move. Can you touch it again? Perfect, back to your nose. Touch my finger, back to your nose. You've passed, A+. Excellent. So that's testing for cerebellar coordination, and that is called a rapid alternative movement. I'm also gonna do, since we have the upper extremities, I'm gonna have you put your hands up on your lap, and I want you to go back and forth. Back and forth. And you're looking for coordination and symmetry and able to follow directions appropriately. Perfect. You can relax. All right, let's go on. We're gonna move to the lower extremities. Okay. So what I'm gonna have you do is lay down. I'm gonna pull the bed out to make it a little bit more comfortable. I'm going to bring up your gown just so I can see your upper thighs. And again, we want to do flexion, extension, abduction, which is moving the legs out, and abduction, moving the legs in. And then we're going to focus on knee flexion and extension, dorsiflexion and plantar flexion. So hip first. What I'd like you to do is keep your leg nice and straight for me, toes pointed towards the ceiling. And I want you to lift this leg up for me. Perfect. I'm going to try to push it down, don't let me. Gentle, perfect. On this side as well. Lift it up, perfect. And then next, bring it up one more time. I want you to push down on my hand, which is testing the hip extension. And this side as well. Push down. Excellent, great job. So for hip flexion, we're testing L1. For hip extension, S1. Really look at your myotomes. Everything here is going to be the L1, 2, 3, 4, 5, and then S1 is really the back of the leg. So L1, 2, 3, 4, 5, and then S1 is the back. So those hamstrings for extension are S1. Okay. Next, we're going to do adduction, which is the adductor longus muscle, which is L2, 3, 4. And after that, we're going to be doing abduction, which is pushing those legs in. Okay? I'm going to have you push your legs out towards my hands. So push them out. Excellent. And then push them in. Perfect. So adduction is pushing them in. Abduction is pushing them out. Excellent. Okay. Now we're going to do the knee. So we're checking those quads. L3, L4. We're going to bend your knee for me. And then bend your knee here. So what we're going to do, I want you to try to kick out, keep your legs straight, but I'm going to resist you, okay? So I'm going to hold here and push your leg out for me. Excellent, relax down, and same thing here, push your leg out. Perfect. And now I'm going to straighten your leg a little bit. I want you to try to pull your leg towards your body, and I'm going to resist you, okay? So that's knee flexion, and again, knee flexion. Perfect. So for the knee extension, those quads, L3, L4, knee flexion, those hamstrings, L5, S1. Then we're going to do the toes and the feet. Dorsiflexion is towards the ceiling. Plantar flexion is towards the floor. Like you're going to plant your foot on the floor. So that's how, so dorsiflexion is up, plantar flexion is down. So to test for dorsiflexion, which is L4, L5, I'm gonna ask them to bring your toes to the ceiling. Don't let me push your feet down. And we can test those bilaterally. Perfect. Now I'm gonna be pushing up towards the ceiling. I want you to push down like a gas pedal. Push, push, push. Perfect. Again, we're looking for symmetry and tone and making sure those are equal bilaterally. We can really isolate the L5 nerve root by testing the big toe against resistance. So I'm gonna actually bring your legs out straight. I'm gonna bend your big toe down. I want you to try to bring it towards your head. So that's really isolates the L5 nerve root. Push it down, he's trying to push it towards his head. And we're testing again for that strength and symmetry bilaterally. Now people who have herniated discs, really pressing on that spinal nerve root, L5 is affected a lot of the time, so they would have pain or they'd have weakness with that kind of maneuver. All right, so next we're going to be testing for the sensory, again, of the lower extremities. First we're going to do light touch, doing just a dab motion, really isolate those dermatomes and make sure we're doing at least 2 on each side. And you can use our finger, and then testing for sharp and dull sensation, because those are different tracks in the sensory system. Okay, Mr. Lane, I'm going to be touching your legs.
Okay.
Close your eyes, let me know when you feel it, just say now.
Okay.
Okay?
Now. 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 Now.
Excellent. If you open your eyes, I'm going to be doing that sharp and dull sensation. So this is what it's going to feel like for dull, and this is what it's going to feel like for sharp.
Okay.
Okay, let me know when you feel it on either side. Okay, you say now and then dull or sharp.
Okay. Now, dull. Now, sharp. Now, dull. Now, dull.
We'll try that one again. It's a question.
Dull.
Good.
Sharp. Dull.
Perfect. Great job. So that one we actually assessed 3 dermatomes, but just do a minimum of 2. Okay, and that joint position sense we talked about, we can do it with the upper extremities, but what I'm gonna have for proprioception is the word for the joint position sense. So Mr. Lane, I'm gonna be moving your toe either in up direction or down direction.
Okay.
This is on your right foot, this is your left.
Okay.
Let me know which foot I'm touching and if your toe is up or down.
Okay.
Please close your eyes for me.
Left up. Right down.
Perfect. Thank you. And you can also test cerebellar coordination. So I have them, if you don't mind, taking your heel, and I want you to run it down your shin. And you want to see that they're able to keep it nice and straight in a fluid motion. And the same thing on this side. Perfect. And then if you don't mind, tapping on my hands with the balls of your foot. Tap, 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 back and forth. Perfect. And that's a rapid alternating movement as well. So just that, test the same thing in the lowers that we did with the uppers, going back and forth. Okay. So I think that is everything we want to do in a supine position. Okay, so I'm going to have you sit up for me. Bring those legs down. And the last 2 reflexes we want to do, which are everyone's favorites, are the patella. We're going to do the Achilles, and then we're going to check for the plantar reflex. So this is where, again, we're going to relax. We're on the beach in Hawaii. Okay, you can close your eyes. And I kind of give the leg a little bit of a wiggle. I palpate where the patellar tendon is, and again, I let my hammer do the work. You got a little bit there. And if sometimes you're like, I want a better response, what I have my patient do is hold your hands. I want you to grasp your fingers like this, and I want you to pull. I want you to pull. Really focus on pulling that. So we get a little bit more there. Let's try this side. And you see there's a little bit of flexion of the foot going there. Not very apparent, but it's there. For the Achilles, you want to gently dorsiflex the foot to just stretch the muscle a little bit, and using the flat side of the hammer. And you're feeling that contraction on your hand. Here too. little contraction there. For the plantar reflex, you can do this in a supine or you can just do it down here. So I use the bottom of my reflex hammer and I go from the outside of the foot towards the toes. So if you look outside laterally and then swooping towards. And what you want to look for is to make sure these toes do not flail out. When this happens, it's called a positive Babinski sign. So if we don't see anything, and sometimes you can actually see the curling of the toes, that's a normal response. And we want to do that on both sides. And again, just gentle pressure. I don't see any flailing of the toes. And you can see a little bit of contraction of those toes down, which is normal. Sometimes you have to press a little bit hard, especially people who have calluses on the bottom of their feet, just so you're able to elicit a response. Okay. Perfect. If any of these lower extremity reflexes seem hyperactive, meaning that when I'm hitting that tendon, this leg is really kind of coming out, or if I'm hitting the Achilles and the foot is really coming down, and I want to test for clonus of the ankle, what I do is relax your legs for me. And this is only if you're getting an abnormal reflex response. Close your eyes. I'm going to be moving your foot, and you kind of just gently relax, and then you just go back and forth, up and down, and then you push your foot up rapidly in a brisk dorsiflexion. And if you see the foot kind of coming down and making a flapping-like movement, that's a positive clonus sign. And you do it on both sides. Gently relax, and then briskly pull up, and then what you would see is a flapping again on that side as well. Bending up and down is so fun. All right, so the last thing I'd like you to do, Mr. Lane, I'm going to have you walk around a little bit. I'm going to assess your gait to make sure it's nice and balanced and symmetrical. We're looking at your stride, making sure there's no imbalance. Okay. So I'm going to have you walk to the door. So again, testing for posture, stride, symmetry, and balance for abnormal movements. Would you mind walking in a straight line to the desk? And then on the way back to the door, can you put one foot in front of the other? So that's a tandem walk, which takes a little bit more of a cerebellar function to perform. Perfect. The last thing I'm going to do is called a Romberg test. Would you mind standing right here for me? I'm going to have you close your eyes. You don't have to actually have them put their arms out. Some people like to do the pronator drift and the Romberg at the same time, but it's hard to assess both of them when they're being done simultaneously. So for the Romberg, which he's doing right now, you want to prepare if your patient is imbalanced and they're going to fall to one side, you have to be able to catch them and they can open their eyes. So closing their eyes makes them think about their position sense, and we're looking for any imbalance or excessive swaying. So this is a normal Romberg test. Thank you very much. Open your eyes and take a seat. All right. I do want to briefly just talk about the meningeal signs called the Koenigs, the Brudzinskis, and fornucal rigidity. Now these are really specialized neuro testing if we're having a patient that we're considering meningitis or any kind of meninges inflammation. Generally they come in with fever, headaches, and they have a really stiff neck. So I'm just going to briefly show those. If you don't mind laying back for me, and bring your legs out here. Always support your patient's legs. Okay. So we're going to have the patient flex their hip and knee on one side like this, and they're going to try to sit up. So you're going to try to actually bend your neck and sit up for me. If that elicits pain, relax. Then we get a little bit more concerned, and we want to do the other side as well. And bend this one, and then sit up, and that's called the Koenig sign. Is that painful at all?
No.
No, and you can lay back down. Perfect, just like that. The Brudzinskis, doing a passive flexion of the neck. So I'm going to be moving your head. I'm going to be lifting it up. What I'm looking for is if the knee on either side actually starts involuntarily flexing up. So I'm just going to grab the back here, let me move your head around. So I'm going to passively move his neck up, and I'm looking at the lower extremities if I'm seeing this happen. I'm seeing gentle flexion of the knee and the hip. And that's a positive Brudzinski's if you see that. And then we're also always looking for nuchal rigidity, which is when I am passively flexing my back, if there's any kind of pain or stiffness. So I usually do the nuchal rigidity prior to the Brodunskis, because if this alone elicits pain, that's positive nuchal rigidity, and it kind of gives me more of a correlation with this could possibly be meningitis. So just gently lifting the head up passively. If that hurts, does that hurt at all?
No.
Then we have to consider that that's a positive finding. All right, you can sit up. I'm going to put this down. Excellent. Okay, so in the next video, I am going to show you vibratory signs when I go grab my tuning fork. Thank you, Mr. Lane, for your time. I appreciate it.